One of the most common questions we get is how do we choose our breast implants? And so there's a couple of factors that are at play. So one is whether you want saline or silicone. Our most common is silicone. And when it comes to choosing that type of silicone implant, the factor that you want to consider is the cohesivity. And so basically what that is how cross-linked the silicone is within the implant. And so for example, for Allergan, there are 3 different types of implants. And so you've got the responsive, the soft touch, and the cohesive implants. And so basically how cross-linked the silicone is will determine how well the silicone implant maintains its shape. And so when you're laying flat, you can see minor differences between the two, but where you really notice the difference is when you are standing up. And you notice the less cross-linked the silicone is, the more it has that teardrop shape. Whereas the more cohesive you are, you maintain that fullness up top. So if you're looking for super perky implants, even when you're standing up in a swimsuit and you've got that fullness up top, the more cohesive implant is what you're going for. But if you want a more natural look, a more teardrop shape, then a more responsive implant is the way to go. Now that we've gone over choosing how cohesive you want your implant to be, let's talk about size. And so in general, the big thing with choosing the size of your implant is there's a couple of factors. One is the volume of your implant, and the other just kind of is the general shape of the implant. And so what you get the most choice in is the overall volume. So what you'll look and feel like in a bra. And so what we actually do is at your clinic appointment, we have you wear a sports bra, and we have these sizers that you basically put in the sports bra. And so you can feel what implant size will correspond with an increase in the sports bra. Now that we've talked about the size of the implant, one of the other factors is what profile we're gonna go with. And the way to think about profile is it's more like a ratio of the size that you want and what fits your chest and frame best. So for example, this implant right here is 445 cc's, and it is the cohesive extra full profile. At that given volume, it's this wide, right? But for example, say someone has a slightly wider chest, but they still want the same volume implant. So instead of an extra full profile, you do what's called a full profile implant, which is slightly flatter and therefore will sit on a wider person's chest, but still give you that same amount of volume. You just have a little bit less projection. And so what happens is the profile really just describes the width of the implant to the given volume that we're working with. Bottom line, at the end of the day, when you're choosing your implant, you really have 2 things that you have the most control over: how cohesive your implant is, and then what size implant you want. Everything else in terms of profile, that sort of thing, is about what best fits your frame. And that's kind of where we come in the operating room to see what both matches your frame, your wish pictures, and what your dream look is. If you have any questions about choosing your implant or the general process here at NTPS, I'm Dr. Arvind Manisundaram. Click the link below to have access to our website, the Dr. Manny at Instagram, and hit us up.